as well as Chesapeake Regional. So with that, we are very preventative based, whether it's managing or preventing chronic diseases, putting emphasis on nutrition, drinking water, safety. We're kind of tasked with a wide range. Here is our 5 objectives. And I will send you the PowerPoint if you want to go along with it, so I don't have to just read all of this.
Thank you.
Here's a large list of our partners that we work with. Also not going to read them, but you can see it's quite a bit. So the Hub is my diabetes and hypertension support program. It is our program that primarily focuses on prevention and management of diabetes and hypertension, since it is the 2 highest chronic diseases that we face in the city of Chesapeake. So with the Hub, we meet every Thursday out in South Norfolk. We have the health department provides an RN that does health education and vitals. Chesapeake Regional provides a diabetic nurse practitioner that does education, helps with equipment, anything that we need that specialty for. We also have social worker on site. We do medical resources. So if they need a wheelchair, a glucometer, a pill cutter, anything, because it is primarily low income and we do not charge anything for the service. We are grant-based and city funded. So that has been what's able to have been funding this program for a little over 4 years now. I've been with it. So within the last year, we had over 1,500 visits to our site. Yeah, it's a lot. So they primarily are there between 45 minutes to an hour, and it's a one-stop shop. So they get to go into different rooms and see each of the providers that we have. And then when they leave, they have a tracking sheet for their blood sugar and blood pressure that they bring back the next visit, which is about 2 weeks. And they get around a 40 to 50 pound bag of fresh produce and lean protein. That also is at no charge. And that's kind of been how we get them to come in and keep coming in. And it's helped to offset a lot of their medical costs. It's about like $75 worth of food that they don't have to spend, so they can put it towards their medications, paying rent, whatever they need. With the Hub, we work with Chesapeake Fire Department, who created a program called Mobile Integrated Healthcare. It's new, it's about to be replicated in Virginia Beach, I believe. So their purpose is to prevent unnecessary 911 calls, transportation to the ER. So if somebody's having an issue with their blood sugar, they don't need to go to the ER. MIH is able to go there without the fire truck and the ambulance and all these things that cost a lot of money to the city. And they help things with public health. They'll do lift assist. They can bring supplies to the houses. So what we learned, especially during the COVID era, 2020, that transportation is a large problem. A lot of our chronic diabetes and hypertension clients throughout the city are homebound, whether it's transportation or they can't move, they're bedbound. So we're able to have the MIH providers come to our site on Thursdays. They get all the equipment and supplies and food, and then they go to the houses for a home visit and then report back to us with whatever is going on, which has been very helpful for us to be able to reach the ones that are having a hard time managing their chronic disease, and getting to their doctors is enough of a challenge. So we're able to do a high touch model, whether they come to us or we go to them. So we get our food from the food bank out on Tidewater near ODU. That started about 3 years ago. It was a food as medicine pilot that's just been extremely successful and continuing. They're basing their mobile pantry, their healthy pantries off of this because we're able to collect that biometric data that shows that it's not just getting food, but what kind of food. So last year alone, they donated over 20,000 pounds. And we're talking chicken breasts, milk, things that, especially now, cost a lot of money. And getting the fresh produce out is amazing. So it's all low sodium, low sugar. And with that, they get education on how to freeze foods, how to cook them. We get rutabagas, which nobody knows what to do with. So they get recipes and we challenge them to try new things because you're less likely to purchase a rutabaga in a grocery store to try it. But if somebody gives you one for free, it's a little different. So with the hub in the past year, part of what we track is ER visits, hospital overnight stays. It's a big incentive for Chesapeake Regional, which is good funding for us. We save them a lot of money by helping keep the blood sugars in check and giving them other resources besides just going to the ER as your number one thing. They know how to call, they can get MIH to come out. We'll help them get a hold of their provider if it's needed, if there's some sort of barrier there. So we had quite a bit of a decrease in ER visits. The overnight hospital stays were about the same, and that is for surgeries and things outside of the diabetes and hypertension. So one of our big biometric things that we track is hemoglobin A1C. As blood sugars change throughout the day, this is a good 3-month average on what their blood sugar has ran. So in the past year, we had 80% show improvement to their A1Cs and an average drop of 1.7, which is a big drop. And it's proven to do a lot of healthcare cost savings, whether it's kidney disease, again, ER visits, just that 1.7 drop, getting them either pre-diabetic or a little bit more controlled. And then we can get them off some medications if possible, which is another cost saving. So with Healthy Chesapeake, we also do a lot of community outreach. The hub is just one program that we do that is hands-on direct patient contact. A lot of our preventative service is getting people to get moving, get out, get connected with one another for mental acuity, getting kids ready for school, getting our seniors to interact, whether it's crosswords or playing cards with one another. We do water bottles throughout the community to push drinking water and with the kids. And then we also help with screenings for A1C and blood pressure throughout the community in partnership with the hospital, the health department, other nonprofits. You can see a little list. And then of course, vaccination clinics, because we are part of the health department. And we do health fairs for people who reach out in the community, whether it's a church or a location or housing unit. We help them set up health fairs to bring resources to them because again, transportation is limited in our low income areas. So there is no one-stop shop. So we make it in their neighborhood. They're more likely to come out, get their vaccinations, get a water bottle, hula hoop, whatever we can, get them moving and getting engaged. And this is where I will transfer it over to my partner, Teresa.
Thanks, Danielle. So my name is Teresa Licato. I am a trained chef and certified dietary manager. I run the Healthy Chef program, which is focused on nutrition and health management through food literacy, health education, healthy food access, and reducing food insecurity. It's a huge undertaking. Next.
Oops, sorry.
That's okay. So the Healthy Chef program is under a larger mission of food connection. So there's multiple parts of this program that make it successful. And to make it successful, there has to be several moving parts. So Garden to Table is one of the programs that we run, which is providing resources and opportunities for individuals through free community gardens, so they can learn how to grow their own food, and they can actually have healthy food access through that. The reason we created Healthy Chef was because, okay, we help people get the food and help them receive healthy food, but then what do they do with it? How do they cook it? How do they prepare it in a healthy way? So that is where Healthy Chef comes in. And Healthy Chef provides support for food security through food literacy, health and nutrition education, hands-on cooking classes and demonstrations within the community events, focusing specifically on underserved communities within the city of Chesapeake. So community partners, Danielle had that huge list. This is, we would not function without our community partners. It is a collaborative effort within the city to make things successful for the community that we serve. This is the main partners that I work with for Healthy Chef, and this is not even everybody, but it's this is really everyone that is really involved deeply in food connection. So we help with their programs and supporting their programs, and they help with us. So Garden to Table. Community gardens. We have 17 active community gardens right now throughout the community. Now, it's in multiple different facets. So some of our partners will work specifically with seeds and seedlings and then distributing those seedlings to the gardens throughout the community. Others help promote and run the gardens themselves. It could be individuals in neighborhoods. It could be church communities, low-income housing neighborhoods, and even other partners like the WIC office and 4Kids, which is a homeless shelter. So you name it, even the police department and the juvenile justice system, they all are participating in making the community gardens a success, and getting food into local food pantries and into the hands of the underserved community. So that's our healthy food access. And we help with the seeds, seedlings, harvest support, and the juvenile justice system in general is a huge part of this. So the women's jail, these are some pictures of the women's jail and the greenhouse there. They have, Master Deputy Simeon is pretty amazing. She has developed this garden and this greenhouse to where it's self-watering and sustainable. She had to build these cages around the gardens because there was a gopher that dug his way into the property and he was eating all the vegetables. So she had to figure out a way how to support this. But it gives the people who are serving time some purpose so that they can give back into the community. They're learning a skill also. They're learning how to garden. They're learning how to provide food for themselves later on in their life. So it's a life skill, but it's also a community project to help those in need. The juvenile Chesapeake Juvenile Services is another one that has an aquaculture bed that has, like, they have fish that are circling, and they use that water as fertilized water to make the garden and the items in the greenhouse thrive. I mean, they're amazing. So just CJS alone, just this season, donated about 100 pounds of food just from their small garden that they have. It's pretty amazing. So we wanted to see how to help support further in the justice system. And that's where Healthy Chef came into collaboration to help support Garden to Table. You can go to the next slide. So Healthy Chef, we decided to help build a program for Chesapeake Juvenile Services, providing life skills and potential job opportunities for the future after these kids are out of detention. I developed a program called Healthy Foundations, where I went into the juvenile detention center and taught a culinary skills class, actually taught a food handlers serve safe certification program that would certify the kids for 3 years. And so when they got out of detention, they have an opportunity, they have a certification in hand that helps them go into any restaurant, any culinary facility, any food service industry where they would actually be able to obtain employment. So this is what you're seeing is the curriculum focus for the Healthy Foundation series. Introductory courses on safety and sanitation, vocabulary, food identification, cooking methodology and applications. So an introduction into the basics of food. It actually helped to put food into these kids' hands and give them a little bit of autonomy in creating something for themselves and getting an immediate satisfaction out of it. So they have an immediate reward. So they, and most of them had never cooked anything for themselves before. Now we're talking teenagers, 14 to 19 years old. Some had never boiled a pot of water. Some had never gone into the kitchen. Well, grandma doesn't let me in the kitchen, you know? So some not interested at all, but by the end of the pilot program that I ran in the spring, they were all getting up on their own and participating within the class. We had to build, it was tough going in there. I had to build some trust with them, let them know that, you know, I'm here to help you learn a skill and help yourself. So whether it's just a life skill and they're not interested in working in any kind of restaurant or anything like that, that's totally fine. This gave them life skills and support, so and then some nutrition understanding, like, why do we eat this and why is this good for you? And then building on to where they could actually create their own meal for themselves and even feed their family. I had some kids say that they were excited to tell mom and dad about it. They bragged about having salads and making their own salad dressings to their other teachers throughout the day. We saw real behavior change in a short period of time, just because they were excited about doing something for themselves, which is not something a lot of these kids in detention centers would have. So the idea of this is to run the program again as a train the trainer program. So they will have this program in-house and then eventually, hopefully, run it throughout the state of Virginia. Next. Community events. So just like Danielle, we a lot of times partner together in supporting the community events and community engagement. Some of the things that I provide with Healthy Chef for community events are healthy food samples, cooking demonstrations, food identification, helping with recipes for chronic disease management. I do a lot of recipe building for diabetes, health, chronic, many chronic diseases, cardiac health, and trying to help people understand the benefits of you know, why you need to increase your fiber and why those count as carbs, but they're good carbs, not bad carbs, and how they help process the fats out of your system. And then what is a healthy fat? What is a non-healthy fat, and why you need to cook with certain cooking methods versus others. So like what you're seeing here is they did an employee appreciation event at the Human Services Department. And we had about 150 participants in 15-minute cooking demos where they made a smoothie. They were able to create a healthy snack on their own with apples and bananas and different types of nut butter, other toppings like unsweetened dried fruit, nuts, and then made an extra snack with the leftover ingredients that was a trail mix. And then I gave away samples to them for, they were fig bars, unsweetened ingredients. So the only extra thing on there was some high-end dark chocolate, so like 60% cacao dark chocolate. So just to give a little sweetness, but unsweetened coconut and the benefits of those things of getting those healthy fats. And why should you eat this? And why do I need fiber? So it's really important for people to understand ingredients and why we use them. Next. I also do healthy chef cooking classes. I seem to focus mostly on kids and teens and actually gone even into elementary school age kids. They seems to be the most interested area for the cooking classes. I've done some for adults and seniors, but really the focus seems to be on the kids. Because if we introduce ingredients early and teach them to cook for themselves, and then they identify these ingredients, the world is their oyster. You know, they're able to build healthy habits from a young age, and they won't grow up cooking, you know, in the fry daddy every day. Instead, they're baking and they're sauteing or they're steaming, and they're using, you know, the right fats to cook with, choosing the right ingredients. So this is the library, some events that I did at the library where kids were, I try and hold a nutrition session first, talk about the recipe we're making, going over how to make the recipe, why we're choosing these ingredients, how to use these ingredients, various different methods you can use these ingredients in, and then actual production, and showing them that it's not difficult to cook for yourself, and having a little autonomy in it, and having some fun, and it's not just, you know, tedious and difficult, and it can actually be an enjoyable experience. So they tend to have a lot of fun, and they make friends, which is really, really cool. I held a week-long cooking camp for UMFS, which is for Project Life adults, well, young adults, so 14 to 23, who were foster kids who had been adopted. So they've gone through a heavy transition in their life. And I had 8 kids come in who'd never met, and they were able to go from not knowing how to cook a meal to making chicken stock, and then learning how to make a sauce, learning how to saute chicken, learning how to cook vegetables and grains, and then making a composed plate at the end, inviting a family member to come and join them for a meal. And they all made friends and exchanged phone numbers. And so it was a really amazing opportunity for life skills and team building and community connection. Next. So last year, we had an opportunity to participate in helping a partner, which is 4 kids. They are a residential homeless shelter for children and families. They have a commercial kitchen in their building, and they needed someone to help build their food service program. they had no idea what they were getting into when they built an industrial kitchen in their building, and what they needed to do to make sure that they could meet their grant guidelines and provide healthy food and healthy ingredients to their families who are in residence there. So I developed a program that met their CACFP guidelines for their grant, and hired a team, and built a volunteer support program to help the staff every day. And we provide grab and go items for breakfast and lunch daily, and then a hot meal every day for the residents and their after school programs. There's about 70 people in residence there, and about 80 kids enrolled in their after school programs. And some of these kids, this is the hot meal that they get for the day, other than their lunch meal. But we do this year round, so it's throughout the summertime also. They do have a second location. We send meals to that Suffolk location also to provide the same quality and opportunity for those kids there. We serve about 860 meals-ish a week, sometimes give or take. Everything is scratch made, restaurant quality ingredients. We have a vendor who we've obtained that is helping us with costs. So they're taking away their profit margin so that they can provide ingredients to us at a lower cost. Food is donated sometimes by individuals, and it's really a pretty amazing program. That's a picture of my amazing staff that's there. And Chef Johnny is directly behind me in the middle. He runs the day-to-day there. He's the head chef, and he has got this amazing rapport with the kids and makes the program much more than just feeding people. He connects with the kids, he talks to them, he introduces new foods, and make sure that they try things and taste things, because it's really hard to help people who are in crisis situations, who their go-to comfort food is McDonald's, that maybe they've been eating that for the past several years. Maybe the kids, that's all they've ever known. So it's a little bit of a culture shock to come in and eat healthy food, and oh, I have to eat brown rice and baked chicken and what's this green stuff, So introducing produce and vegetables and incorporating that and getting the kids to actually try the food is a talent that Chef Johnny definitely has. So pretty awesome. Next. So here's some pictures of the healthy food meals that we serve. So the families have opportunity to either come down to the cafe and eat in a community style, family style setting, or they can, if say they have conflicts with jobs, schedules, things like that, they can order a late plate, and we provide meals for them to pick up at a later time. So we support our local interns with the Culinary Institute. Autumn at the bottom left there, she has been a godsend. She's amazing. She's was a young intern, went through the diploma program at the Culinary Institute and really wanted to do something with kids. And she is loving being there and helping, and she works hard and she learns quickly. And so we've tried to help her grow in her goals, and also grow the program at the same time. So this is about food security, providing healthy food access through these healthy meals and getting kids to try it. The picture in the middle there is chicken ramen. So ramen, not cup of noodles ramen. So and the kids love it. They absolutely love it. So it's very rare that they don't trust something, or they don't like something. So it's pretty amazing to see this happen before us. Next. And our volunteers. So we partner with the who mostly are the ones who support us. We have, uh-oh, it says my internet connection is unstable, so I hope I don't lose you. So our volunteers, some of them come in on a regular basis, multiple times a week. And others come in when they can. I put up a sign up genius. I send it out for several months at a time. They sign up for 2-hour shifts. Some sign up for multiple 2-hour shifts per day or per week. And they are a great support, especially because, you know, we're cooking scratch food, making scratch food, bulk quantity. So, you know, Gail's doing about 250 meatballs at a time there. So, you know, it's a lot. Recently, we've partnered with CIBH, and it's behavioral health. They have a program for adults with disabilities. And in the center there, you'll see our employee Laura. She's assisting one of the CIBH program adults and giving them a task, a meaningful task to do. That's something that's simple and how it's rewarding for them, but it's also rewarding for us. So it's a way for us to help and partner with someone else in the community who is doing some amazing work. Next. So full circle, connecting the Garden to Table program and the Healthy Chef program under Food Connection. This is the rooftop garden, which is one of our community gardens at 4Kids. They have this amazing building that was built on 100% donations in the middle of South Norfolk on Poindexter. And so they decided they wanted an urban orchard to provide food for their residents. And so we helped create this rooftop garden for them with the help of the Virginia Cooperative Extension Master Gardeners, who help to maintain this garden through their volunteers and their education. We have planted spring and summer and now fall vegetables and fruits, and we have been actively using them in the kitchen, which is pretty amazing. I've held classes, lunch in the garden for the kids throughout the summer so that they could see the garden in full bloom, and then made lunch with them so that they could actually eat what is growing in the garden. So they can see, and they were so excited, and they went and they each got a little basket, and they got to pick some fruits and vegetables and take them home. They were absolutely thrilled. And the fact that they're picking blackberries and going, can I eat this? Can I eat this right now? I said, absolutely you can. And the fact, like, you know, watching them, one was just covered in blackberry juice and watching the enjoyment on their face of eating something fresh from the garden. Because one of the goals is to make sure that the food is accessible to them at all times. So we use, it's free from all pesticides. It is 100% organic. So even the flowers are edible. So I made sure that everything that is up there is edible, 100%. We use the flowers as garnish and in salads. So I wanted to make sure that they could go up there at any time with people, without people, like with, you know, without support from us as employees of Healthy Chef. The kids that live there could actually go up there at any time and pick strawberries and pick blackberries and blueberries and green beans and soybeans and cucumbers and tomatoes, and I mean, you name it, it's up there. Cauliflower, cabbage, figs, peppers, multiple varieties. So you know, and they could go up there anytime and eat it. So So it was really important part of Food Connection to become full circle with Garden to Table and Healthy Chef, to make this a truly successful program for the underserved community that we are helping within the city of Chesapeake. And one of the benefits also of having the kitchen there at 4 Kids is that we also can provide emergency meals for people that that are part of Danielle's program. And within the community, if we get a phone call, we have meals that we can throw into the oven at any time, and they're hot and ready to go in 30 minutes. So we make sure that we prepare them, we freeze them. We've got these beautiful state-of-the-art ovens that will cook things in healthy cooking methods. No fryer on site, and we can provide those meals in emergency situations at any time. So that is the Healthy Chef program. I'm happy to answer any questions that any of you may have.
Well, thank you. I guess, sorry if anybody else had a question they were really wanting to ask. So if someone were going to try to begin something like this or any kind of program of or pertaining to this, how would you suggest they start that? Or how would you suggest they reach out to different organizations to maybe collaborate or come up with ideas? Because I know we have a lot of local communities and we do have a lot of students that are not local in the public health programs. So if they wanted to be involved in something like this, but weren't necessarily local and maybe wanted to start something like this, how would you suggest they begin? Or do you have any advice on that?
Danielle, you have anything?
I would go to your city's website and see what resources are available. Cooperative extensions are everywhere. Your health departments are everywhere. Healthy Chesapeake is obviously a Chesapeake bound. There's only one other Healthy Portsmouth out there. It hasn't been duplicated anywhere else. Otherwise, I would say find it. It really is, there's resources everywhere, and finding it is the biggest challenge always, right? There's never one beautiful website that you can go to and it tells you everything you need. It takes a little bit of digging. But I would say start with your city website, any cooperative extensions, and your health department.
Thank you. And I see we have a question in the chat. If we wanted to volunteer with you all, where should we begin, or where should we sign up or register? And also, if you have anything you would like us to send out to our members because you need volunteers, we are more than happy to send out any kind of alerts for events that you have that you might need more volunteers for.
Absolutely. I would say go to our website. You can reach out either directly to Teresa or myself, or the website is our generic one. And then it'll get sent to either one of us based off of, whose wheelhouse it's under. But there's always things that you can do to volunteer, whether it's a one-time just come out event, or if you're interested in staying with the program and following it. I put the email on here, or our website on here, and then you'll see. And yes, we go through the MRC, which you would get a background check, depending on if it's a one-off event or if you're working with kids. We do a lot of the vulnerable populations, so background checks are required. And the MRC is for free for you, and then you would be able to be activated for anything that the health department needs. So I'm an MRC volunteer, it's Medical Reserve Corps. And I'll get activated for vaccination clinics or emergency disaster relief, anything like that, which from public health is exciting.
And if, we'd love to have you volunteer at the kitchen at 4 Kids. It's, we thrive with volunteers. So we're Monday through Friday volunteers. and you do need to be background checked because it is such a vulnerable population. We have kids in residence there. So that's why that's required. And going through MRC helps us to just cut out any middleman. We go directly through MRC volunteers, and that way we don't have to handle background checks for everyone because we are a small staff. There's 5 of us. So this MRC is the perfect way to go, and they're fantastic there. Heather will help guide you if you're interested in working with Healthy Chesapeake or specifically with Healthy Chef for 4 kids. She'll set you up with my sign up genius. Yep.
So depending on wherever you are, you can go to different cities as an MRC volunteer. So if you're in Norfolk, you can be an MRC volunteer for the Norfolk Public Health Department, but that would cover you if you came to Chesapeake for something, because we're all Hampton Roads, we're all together and all of our cities touch one another in the same street. We're pretty flexible with city limits and border lines. So that's a great way. And no matter if you're in another state, whatever, that's a really good resource if you want to volunteer in the public health arena, at least.
Thank you. Yeah.
In eligibility for people to participate in the HUB program.
So the HUB program gets a little tricky because we are dealing with healthcare and HIPAA, all that fun stuff. So we don't typically take volunteers. We've taken interns because there's a little bit more continuity there. You can always come stop by and see, but I can't let you sit in the rooms because again, it's HIPAA, it's privacy, people's lives. But it is fascinating to be there.
Yeah, absolutely. I meant more the people who are actually in, like, the participants in the HUB program. Like, is there a health screening process for them, or do they get referred by their doctor?
They get referred by their primary care provider, and so they can self-refer to us, but then we've got to send the referral to their PCP to fill out, to approve, because we get their medical history and we follow back with the primary. If we see an A1C that's 11, we're like, hey, you need to go to your doctor. We need to change your insulin. Something's going on. So it is how we make sure. So, and the eligibility also is it has to be low income. That's how it's no cost and grant funded. So it's primarily if you qualify for any government assistance, then come on by.
And we have another question in the chat that says, if we are interested in finding out where community gardens are in Chesapeake or about starting one in a certain area of Chesapeake, what options are available?
So I'll email a list of our community garden contacts to Erica so that you guys have that and she can send it out to you.
Thank you.
Perfect.
Hi, I don't want to hijack your meeting. I just saw the invitation go out and I wanted to introduce myself because you're probably like, I don't know who a couple of these people are. My name is Erica Howell. I'm the coordinator of marketing and strategy here in the College of Health Sciences. So I saw this public health talk go out, and these are the types of partnerships that stories about these things perform really well. So if you all are interested in me doing a write-up about your public health talks and how these lead to partnerships and what you all do outside of these webinars together, whether it be volunteering or future jobs, or if there are alumni working for these kinds of organizations, those are the kinds of stories that I am looking for. So again, I don't want to hijack your meeting, but if you want to reach out to me, it's Erica Howell. I will also be at the homecoming football tailgate on Kaufman Mall. Sina is volunteering with me. So we'll be out there with some swag, hey, and out there like advertising the program and that sort of thing. And Liz is a friend of mine, not affiliated with ODU. I apologize. She's just really interested in this stuff. So, okay.
I mean, we're more the merrier. We're happy anybody who would like to come and learn. And we would definitely like to get together with you about that, all the marketing and things like that. So
Great.
I have your email, so we will be emailing you.
Perfect. Thank you so much.
Mhm.
Hi, could I do like a quick introduction here? So I'm a public health student. I do have a meeting at 1 p.m., but I just really wanted everyone to know that I will be also at the tailgate, and that would be really great to see if someone would stop by. But yes, I am very happy I got to join this meeting. I'm in a library and I have another meeting to go to. So thank you so much for being here all.
Well, thank you for coming. And if we have no other questions, I want to say thank you for presenting with us today. Hopefully we can get you some good volunteers, maybe an intern or two if you need.
Yes.
We have many interns. We go through the Center for Global Health.
Okay,
Dr. Michelle Kiki is who our interns always run through. I typically obviously oversee the MPH practicums because that's me. But there are other opportunities for other interests, whether it's undergrad, graduate, just personal passion projects. We're usually pretty good at placing people. And if it's not with us, we can either get you in with the hospital or the health department, somebody based off of what you're interested in.
Yeah, I had an MPH intern last year, and she helped me do a lot of research-based information for my pilot program with the juvenile detention center. So really helpful. It was great. She did an amazing job. So always opportunity.
wonderful. And do you mind if I post this to our public health YouTube channel for anyone who wanted to come but somehow didn't make it? Is that okay?
Sure, fine with me.
Yep, fine with me.
Sorry, I didn't mean to mute myself. Again, thank you for coming. Thank you for presenting with us. We really appreciate you, and hopefully we can work with you again in the future.
So thank you guys for reaching out and taking the time and having the interest in us.
Oh, yeah.
Yeah, absolutely. Thank you guys so much.
So much for having us.